So an example on grandfather, you have 20 employees, 20 full-time and 8 part-time. All full-time employees are eligible for the health plan, 10 individuals participate. That means you are grandfathered. And you will likely stay grandfathered through 2013. That should describe a lot of your companies here. So what's effective now? Probably why you showed up today and not 6 months from now in the next seminar. Plan year beginning October 1st, 2010 or later. It's technically September 23rd, but I'm certain none of you have a September 24th renewal date. No lifetime limits and restricted annual limits are phased out to 0 by 2014 for essential benefits. Now, I often say in my presentations there really still are lifetime limits. Why? Because a lot of the high-cost items, you can still have lifetime limits. And it would be virtually impossible to reach, say, a $1 million lifetime limit on preventive care. But you'll no longer have those provisions. This is really relevant to you if you have a self-funded plan. Insurers as companies have issues with this because they're going to have to underwrite differently and buy different reinsurance models. But for you with insured plans, you'll probably see a little cost uptake is my prediction, but probably not more than 1 to 2% issues. A self-funded plan, I think you're going to see 4 to 6 to 7% on these issues because it's going to cost a lot more to provide the risk on a small group from a reinsurer. So lifetime limits are, again, $5 million a lot. You hear these stories on the news a lot, or fundraisers. Individual has serious cancer, going to exceed insurance lifetime limits, and we need to raise more money to provide for the health care. When anybody has those kind of benefits, it's usually because of a lifetime limit. Or an annual limit, I can have no more than $1 million per year. This is the way large plans try to keep their costs down by not having the big claim set. The very truism in insurance is that probably, a little rock here, but I bet 85% of your claims costs are usually in about 5 or 4% of your employees. Because a few have a really big claims. And most of you go to the doctor a couple of times, and if you're a guy, you probably don't even do that. Particularly gravity is big. So you're not going to prostate cancer screens. So women tend to go 2 or 3 times a year for just preventative checkups. If that's under $1,000, then that's irrelevant in the healthcare world. Because you're paying more than that in the premium per month. So most of healthcare reform is really based on these high individuals and what we're trying to get at, and getting the $228 million. Coverage of young adults until age 26. With the new law, all plans will have to cover young adults to age 26. Most of your plans now cover them probably through age 24, or meaning at the end of age 23. That was the intro on the code. I'm going to get to a slide here that talks about the regs and clarify this issue. But all of you will be forced now to cover young adults through age 26. Now you'll note my note here because this is important in drafting. Insured plans, this won't be as important. That may include independents because it doesn't say you could only have to cover them and stop. If you had a plan that said, I cover children through age 26, that child has an independent enrollment right, and if that child is married and had 4 kids, they could very well cover all of their family as well in that insurance. Which means if you have a rate that covers family plus 2, let's say, and it's $600 a month, you could have 14 people on that rate, which is bad news for your health insurance. So most of you will decline allowing them to cover their dependents, but you better make sure you write it. Because just writing age 26 doesn't do it for you. Under age 27, dependent is tax-free. When I talked about imputed earned income, and if you looked at me like that's a really big word and I don't know what it means, what you should have been doing if somebody gets on your health insurance plan. People always say, well, is that person allowed? You can put anybody you want on your health insurance plan as long as a specific source says it's okay, and the contract terms allow for it. So you want to cover me, knock yourself out. But I would get it tax-free like an employee. So you have to impute income to me. A dependent, before this legislation, that was 25, and you allowed to stay on the plan because, key employee and the kid was 25, didn't have health insurance, they lived at home, lived in the basement, I want them out, I want them to have health care, I want to cover them with the plan, they had to be imputed income for that individual. That's a hypothetical example. I never know anybody like that. 60 days notice of material modification if you're going to make a change, and I don't know what the word material means, but I think it means something big, which probably means something that impacts people, which probably means something like a deductible change or a copay change or a provision. You've got to give 60 days free notice. It's 2013, you've got to write a new form that's called a summary of benefits. I also don't know what that means, but I'm guessing it's going to be about 3 pages and lots of pictures. HSA distribution has increased from 10 to 20%. If you take an HSA today, and you take money out, and you go buy a six-pack of the Arco down the street, or whatever they're called these days, that used to cost you 10% just to take the money out. Now it costs you 20% to buy your six-pack of beer. For Brandon and Hill High, that's a six-pack of hands.